1. A patient with COPD is admitted for exacerbation. The nurse's primary focus is to A. Administer high-flow oxygen continuously. B. Encourage fluid restriction. C. Maintain oxygen saturation levels between 88 to 92%. D. Initiate 4 corticosteroids immediately. 2. Which electrolyte imbalance is most concerning in a patient with acute kidney injury? A. Hypokalemia. B. Hyperkalemia. C. Hypocalcemia. D. Hypernatremia. Three. A patient is prescribed warfarin. What should the nurse monitor? A. Platelet count. B. International Normalized Ratio or INR. C. Partial thromboplastin time or PTT. D. Hemoglobin levels. 4. A practical nurse administers morphine. What is the priority side effect to monitor? A. Nausea. B. Constipation. C. Respiratory depression. D. Sedation. Five. Which developmental milestone is expected in a 6-month-old infant? A. Saying mama and dada. B. Sitting without support. C. Crawling. D. Walking with assistance. 6. A child with a high fever is prescribed acetaminophen. What is the appropriate dosage consideration? A. Based on the child's age. B. Based on the child's weight. C. A standard dose for all children. D. Only under physician supervision. Seven. A client with schizophrenia exhibits auditory hallucinations. The nurse's best responses. A. Ignore the voices, they aren't real. B. What are the voices saying to you? C. I don't hear anything, you must be mistaken. D. Those voices are just in your head. 8. Which sign is an early indicator of lithium toxicity? A. Polyuria. B. Hand tremors. C. Confusion. D. Severe diarrhea. 9. During the first stage of labor, the nurse's priority intervention is to A. Encourage ambulation. B. Monitor fetal heart rate. C. Administer pain medication. D. Check cervical dilation hourly. 10. What is the normal range for a newborn's blood glucose level within the first 24 hours? A. 1.1 to 2.2 millimoles per liter. B. 2.6 to 4.4 millimoles per liter. C. 4.5 to 6.5 millimoles per liter. D. 3.0 to 5.5 millimoles per liter. (11) A client presents with a suspected stroke. The nurse should first A. Administer oxygen. B. Check blood glucose levels. C. Call for a CT scan. D. Assess airway and breathing. (12) Which intervention is most critical for a patient with anaphylaxis? A. Administering antihistamines. B. Administering epinephrine. C. Starting 4 fluids. D. Applying oxygen therapy. (13) A nurse witnesses a colleague diverting medication. The nurse should A. Confront the colleague immediately. B. Report the incident to a supervisor. C. Ignore it to maintain workplace harmony. D. Administer the medication to the patient. (14) What is the nurse's role in informed consent? A. Explain the procedure in detail. B. Ensure the consent form is signed. C. Witness the patient's signature. D. Decide if the patient needs the procedure. (15) Which is a priority intervention for a client with tuberculosis or TB in the community? A. Encourage a high-calorie diet. B. Initiate airborne precautions. C. Educate about the importance of medication adherence. D. Recommend routine chest X-rays. (16) A nurse is conducting a home visit for a client recently discharged with congestive heart failure. The first priority is to A. Evaluate the client's diet. B. Assess for signs of fluid overload. C. Reinforce medication schedules. D. Provide emotional support. (17) A patient with sepsis is hypotensive despite fluid resuscitation. The nurse anticipates administering A. Antibiotics. B. Vasopressors. C. Antipyretics. D. Diuretics. (18) Which sign is an early indicator of increased intracranial pressure or ICP? A. Bradycardia. B. Dilated pupils. C. Restlessness and confusion. D. Cushing's triad. (19) A newly licensed nurse makes a medication error. The nurse manager's first action should be to A. Report the incident to administration. B. Conduct a root cause analysis. C. Provide immediate education and support. D. Terminate the nurse's employment. (20) When delegating a task to an unregulated care provider or UCP, the nurse must ensure that A. The task is within the UCP's job description. B. The UCP is supervised at all times. C. The UCP documents the task independently. D. The UCP is responsible for patient outcomes. (21) What is the primary purpose of electronic health records or EHR? A. Improve patient privacy. B. Facilitate communication among healthcare providers. C. Replace traditional nursing documentation. D. Reduce healthcare costs. (22) A nurse receives a flagged lab result in the electronic medical record. The next step is to A. Acknowledge the result in the system. B. Notify the physician immediately. C. Repeat the lab test. D. Document it as normal. (23) A patient refuses a blood transfusion due to religious beliefs. The nurse should A. Persuade the patient to accept the transfusion. B. Notify the healthcare provider and explore alternatives. C. Inform the patient that refusal is not an option. D. Obtain consent from the family. CPNRE. The Canadian Practical Nurse Registration Examination or CPNRE is a national licensing exam that evaluates the knowledge, skills, and abilities required for entry-level practical nurses to practice safely and competently in Canada. It is a critical step for obtaining licensure as a registered practical nurse or RPN or licensed practical nurse or LPN, depending on the province or territory. Here are 5 top beneficial uses of CPNRE. 1. Ensures competency for safe practice. The CPNRE assesses whether candidates possess the essential knowledge, skills, and judgment needed to practice as a licensed practical nurse or LPN or registered practical nurse or RPN. This guarantees that new nurses can deliver safe and effective care, minimizing risks to patients. 2. Standardizes entry requirements across Canada. The exam provides a consistent and objective measure of practical nursing competency across provinces and territories. It helps maintain uniform professional standards and quality of care nationwide. 3. Protects public safety. By ensuring only qualified individuals enter the profession, the CPNRE safeguards the public from unprepared or unsafe practitioners. This aligns with the ethical and legal responsibility of regulatory bodies to prioritize patient safety. 4. Supports professional accountability. Passing the CPNRE demonstrates that candidates meet the regulatory requirements for licensure. This reinforces the importance of professional accountability and lifelong learning in the nursing field. 5. Guides regulatory and educational improvements. Data and feedback from the CPNRE help nursing regulatory bodies and educational institutions identify gaps in practical nurse training programs. It ensures curricula stay relevant to current healthcare standards and evolving patient needs.